afternoon DJ as well for Afternoons with Sarah. How are you, Sarah?
Hey, I am good. Well, happy very snowy Friday.
I love it.
Man, I woke up and thought, holy potatoes, have a lot of snow.
It's great.
It is great, and my kiddo's school got canceled, so that always throws me for an extra loop.
Well, yeah, because everybody now here in charge of that, they're transplants, and so like it snows a little bit, they're like, yeah, no school.
This was actually quite a big dumping. It was more than I thought, but hey, the kid is happy. He gets to be in PJs all day and watch some TV. So
Yeah, exactly.
life is very
I miss
good.
those days of watching Price is Right when I was a kid. So
It is.
But we have a special guest today. Who do we have, Sarah?
That we do. We have Adam Courchaine.
Perfect.
Yes, I nailed it. I love it. It's a beautiful French last name, Courchaine, from Ascent Concierge Health.
Yes.
Which is amazing. Well, welcome. Thank you for being here.
Thanks for having me.
Man,
Yeah.
if those of you, I know we are the training wheels, which we were just talking about, the training wheels are off, ladies and gentlemen. So you are either listening to us on the app, the K4CO radio app, but if you also would like to see our beautiful faces online, we are streaming this interview live on Facebook, on K4CO Radio's Facebook, and on Instagram, which is K4CO_radio. So now
As
you
well
get
as
to
our
see us.
YouTube,
and
too,
as
so
well
you
as
can
our
even go
YouTube.
there, so, yeah.
It just keeps growing and expanding. So now we're going to have faces for social media. So we're trying.
I was told this is a face made for radio.
We do too.
Definitely.
Okay.
Yeah.
Definitely.
Yeah.
Okay.
You have a great face. No, it's very well fitting. Well, again, welcome. Thank you for coming in.
you.
And this is amazing what your approach is. And we'll get into that. It's very unique and individualistic.
Yes.
So I'm curious about what your background is and what made you start Ascent.
Sure. So one day I was born. Too far? Okay, fine.
Not at all.
I'd like to
I
hear
do that
before
too.
that, you know.
So less
Oh,
far.
no. We don't need to know 9 months before that.
No. It was prayers. That was it. That's what I was
Oh,
told.
okay, nice.
Immaculate conception.
Yes. So I started off as a baby adult doing exercise physiology. So I did that, UMass Amherst, did that for just a year or two, and then I went to Children's Hospital in Boston, where I was a pulmonary tech testing lungs to a lot of sick kids. And I did that for a while, and then I wanted to do more, so I went back to graduate school to become a PA, physician assistant. I've been doing that for pretty much 19 years, and I started off in hospital, internal medicine, pediatrics, geriatrics, then military medicine, so I'm an Army PA. And
Wow.
then from there, we moved to Colorado in 2015, and I was working in urgent care, and that was a good experience. It was fine. I deployed in 2017 in the Middle East, and I joke, my friend Dave's always cold. I'm always warm. And it was 135 degrees there. And I was like, I think we're in hell. It was like being in an oven with a hairdryer in your face. So not for me, but then I came back to urgent care and I said, this is worse. You know, seeing how we treat each other and
Yeah.
the amount of care that we do and try to do. So I don't know if that's a good kind of a quick background, but that's kind of where I started going a little the other way.
Those are some good Cliff's notes. I like it.
Nice.
No, I love it. I won't launch into my story, but I can't tell you how much and how important it is to have good health care. When my kiddo was born, we had pulmonary, we had cardiology, on top of everything else, on top of
Yep.
urology. And man, we had to interview lots and lots of people for many years. So I think you run into some great ones and then you run into the opposite. So having really good people that care about individuals is very crucial in this world.
Perfect.
So are we good? Yeah, that summed
yeah.
everything up in the world right there.
I think so.
Cool. Okay.
I think so. Solved.
Where did you land then in 2015? Well, then you were deployed.
Yep.
And then when you came back,
So
where
that-
did you land in Colorado?
So physically,
Physically,
okay.
mentally, emotionally,
We landed at
psychologically.
DIA and got off the plane. Was happy to be home. Touched the ground. We were in Highlands Ranch. Then I lived in Castle Pines, and then about a year and a half ago we moved to Sedalia.
Okay. Oh, you've kind of covered a whole
A little
bunch
bit of the
it.
south there.
Okay.
The office is 5 minutes from here in Centennial.
Okay.
A lot of people have heard of
Nice.
Gijo's.
Oh, yeah.
That parking lot, that complex. I'm the one closest to the intersection.
That's awesome. You were
Yeah,
very close.
Really close.
So you went back to the ER and said,
Urgent care.
Urgent care, ER. It all kind of blends in with me.
Yeah.
It's all like, oh crap, we have a problem. Let's go
Not
figure
when it
this
comes to
out.
price.
That's true.
That's unknown. Those are medical dollars. They don't really add up to anything.
Yeah. Exactly.
We'll have a talk
Yeah.
offline. And you thought I need to do something different.
Yes.
Okay.
And there's some little catchphrases, but it's really true. They talked about like, what do they call burnout, right? But another phrase is moral injury. Like you're just done. Like you just can't do it. And I remember one of the things for me, not to be doing these cliche things, but I'd have some colleagues that would just blast through appointments. You come in, here's a Z-Pack. You come in, here's a quick little script of something, in and out. And I'd be like, what brought you in today? And how have you been feeling? And all these other things, which I wasn't the fastest, but, I held records for the most people seen, which is not a good thing. But I remember talking to a mom, and it's, I don't know, April. And she's like, yeah, little Jimmy here. It's his 4th ear infection this year. And I was like 4 months? Yeah, I said, that's not okay.
Yeah, that's not normal.
Why aren't you at your pediatrician? Well, we can't get in. And I was like, oh, that's a problem. Mm-hmm. So, of course, we did take good care of people, but that's not the way it's supposed to work. Mm-hmm. So if you're getting sick that often, you probably have allergies. There's something. You got to dig a little deeper.
Something's going on with it, yeah.
So I said to my wife, who's a nurse, I was like, I need to do something different. And then she said, well, in medicine, it's the same stuff, just a different day. And I was like, yeah. And then I didn't create it, but there's a model called direct primary care. So in that one was the whole idea of not using insurance for care, which you guys probably haven't heard of that. So this might be interesting. I guess I'll keep going.
Oh, absolutely.
The only thing I've heard of is now people actually advise you to ask, what's the out-of-pocket cost?
Yep.
Instead of insurance. I'm sure there's a lot of reasons for it. And I also definitely think that things just cost more when you have insurance.
Oh, good God. Yeah, yes,
we can talk forever about that.
Yep.
Yeah.
I've been playing with this since 2018. So it's the math there, 7 years.
7 years.
So, yeah, the whole idea of, if you have a car, I'm assuming you guys drive vehicles, you probably don't walk here, but you have car insurance. And if I said, I have a plan, it's going to cover everything. You're like, gas? Yes. Windshield wipers? Sure. So you're like, great. It's going to cost twice as much, but it covers everything. You're like, wonderful. I'm in. I say, okay. And then you call me tomorrow, like, I need gas. I'm like, well, I'll get back to you in about 3 weeks, and I'm going to have you go to Grand Junction to get it. You're like, what the heck are you talking about? But it's covered. It's free.
Right. Right.
But so what do you use car insurance for? Catastrophic, unplanned for things. If I crash into your car and drive away, insurance. If you want to get your car washed, not insurance. Right. So same thing with our healthcare, really. If I have a heart attack, someone whip out a phone and call 911, and the system's awesome, and they'll take good care of me. And even if I have a high deductible, that heart attack's like $110,000. I'm not. That's what it's for.
Right.
So insurance should cover catastrophic stuff. But
exactly.
And I kind of overlap between insurance and then Western medicine. Because another thing is people say, well, the healthcare system's horrible. And other people say, no, it's awesome. Which is it? And the answer is, well, what are you here for? If you're here for a heart attack, it's awesome. You got a broken leg? Great. Appendicitis? Wonderful. Those are all acute problems. Mm-hmm. But if you said, I feel kind of sad, or my weight's off, or I have high cholesterol, we apply the same system and it just doesn't work. So if you know someone who has high cholesterol, who actually got healthier taking the medications, I'm not saying don't take the medications, but the system is set up to manage it. We manage chronic illness.
Right.
We don't cure it.
Right.
So, if you have depression, you can take an antidepressant. If you have a headache, I'll give you a headache medicine. Right. And then those people with the chronic stuff, which is all of us, say the system sucks. I'm not going until it becomes catastrophic. And then I have this thing. So you can see the little circle. Right. It's kind of a spiral like a toilet. It's potentially going nowhere quick.
Our healthcare is a toilet.
Well, let me rephrase now. For acute care, it's amazing. Nowhere else on earth would I want to be if I have a heart attack. Like, boom. Like, it's a good system. But for all the chronic stuff, you guys don't have to study this, but how's diabetes doing? How's heart disease doing, or Alzheimer's? Like, well, we tolerate it's slowing down.
Is it really? Okay, it seems
But it's
rather
still getting
stagnant,
worse.
but I'm an outsider looking.
It's getting
out.
worse, but the rate, we can slow it down, but nobody's improving it.
Right.
Right, exactly. We're managing it a little bit better. I mean, we were at a diabetes gala or fundraiser a while ago.
Juvenile diabetes. Yep.
Yep.
And so the
Last year.
technology gets better to kind of manage it.
Yes.
But not.
And oh, good gosh. So yeah, exactly. Our tech is better than ever. I mean, how can we not admit that?
Right.
And our ability to do things and study things is through the roof. But what we did is we took all of our eggs and put them in the tech new age way of doing things and threw away all the old. The old was grandma said, stop eating, you're going to spoil dinner, and you shouldn't eat at midnight, maybe, all those wisdoms that we had, and if you're feeling sad, maybe talk to your friend. Talk to someone, have some human relationships. No. Don't, just go on social media. We'll look at our page later and post something, and then your 5,000 other people will comment on it. And anyway, there we
Gotcha.
go.
No, there's a lot of things. So you're telling me carrots do not improve your vision? Is all that was a wise
No.
tale?
Granny said eat your carrots. That's okay. No, that's the
Okay.
old medicine.
Okay.
We should use both.
Okay. Okay.
Yeah.
Yeah, and I mean, I guess I'll say this. So there's this idea of medicine 1.0. Have you ever heard this stuff? 2.0, 3.0.
No.
So the whole idea there is, or the healthcare system, whatever. 1.0, it was the old way.
Okay.
So if we're in like the year 1200 and
Okay.
you have a problem with your knee and the town doc is like, I saw something once, and if we stretch it this way, it's going to feel better. It was great, and you gave him a chicken, right? So that was they knew your family, they were at your house and all that stuff. It was very warm. The drawback is if Dr. Smith was a hack and he's like, oh, your toe hurts, we're going to cut your leg off now. And then you're going to die from infection. So it wasn't regulated in any way, but it had some nice qualities to it
Right.
because you were dealing with humans. So 2.0 came around, and that's the idea that we should have studies. We should do things. We should have prove, human trials, all this other stuff. We should have schools where people are trained. So we should have more of a conformity or a uniform education. That sounds pretty awesome. But we forgot who the patient was. We said, well, I don't care about your particular story. Well, you can tell me, but either way, you're going to get treated just like everyone else.
Okay.
Right.
So we lost it and came up with that. So the whole idea of a medicine 3.0 is, why don't we just use them both? We'll use smart studies, training, education, but remember who the patient is and their story. And if it's significant, maybe I treat you a little differently than I would the guy before you.
Right. Gotcha.
Yep.
Did want to, just because a listener on one of our platforms had a question, and a lot of it, I think, it's so expensive, healthcare, right now. And so we had a question online for someone with limited time and funds. Where would we start to look at options to better our health?
No, I think the first thing is to question and say, I want to do better. Because if we just kind of muddle along and do what we're kind of trained to do, like by the time you're 40, you should have high blood pressure. And by the time you're 50, well, really, by the time 45 will give you cholesterol, and then by
That's
50,
the best
diabetes.
thing I've heard all week.
Well,
You should be feeling like crap. because you're-
well, and that's where an average comes in. But this as an animal is a Homo sapien. We've been in evolution for 250,000 years, something like that. And we evolved to suffer. We starved, easy. Burning hot, freezing cold. We're like, this isn't that bad. Other human species, dead, couldn't handle it. So we're good at surviving. And now we have everything
Yeah.
dying. So where does someone go? It's the first thing is to question, I don't think I want to do it this way anymore. So to question the system. And then just Google one thing. So I should probably explain this. So there's insurance-based medicine. So, and that's the one, I grew up with that. I worked in hospitals. I had regular insurance.
That's the one everybody kind of knows.
Yep.
Is the insurance.
The insurance.
Exactly.
So, and I still have insurance through military, TRICARE. It's awesome. It's
Oh
a
my
really good
gosh.
insurance.
My grandparents had it. It was amazing.
So did I use it for a knee surgery? Yes. Do I use it for health care? No. So, so insurance based. So then some people, years ago, they said, if you give me a pile of money, I'll give you more time. That's concierge.
Okay. Right.
They still bill your, I'm talking generally, but they still bill your insurance. You come in, you pay a copay, whatever, all that stuff. So then this model of direct primary care came along and said, the system's broken. Take insurance out of care. Use
Right.
it for insurance stuff. And then
Catastrophic.
we could do that. So like for me with our practice, I don't need a whole administrative billing staff. There's no insurance hunting down prior authorizations. So they say on average for a medical provider, you're going to need 7 to 8 staff to have a really well-run billing department. That's not care. That's expensive.
Right.
So if we take that out of it, we trim the fat, bring the overhead down, it's a lot less expensive. So, and that's why, like, I've had patients that say, I haven't had insurance in 15 years, which I think insurance is a good thing. I have insurance on the house, the car, and myself and my life. So I never use them, but I have them.
But it's
Right.
good to have it in case
In
of
case.
the catastrophic. Exactly.
But I have had patients say, no, I just realized 15, 20 years ago, I just put $500 into a special account. And now if I need surgery, I just pay 20 grand. Now, I wasn't that smart. I don't have that put aside special in my health
Well,
fund.
I don't know many people who can do
No,
that.
but some people, especially
that's- yeah.
self-employed or something like that. So anyway, so even if you just Google DPC Mapper, direct primary care, so DPC Mapper, you
Okay.
put in your zip code and they pop up. Like, yeah, they're in all states. You can look at them. Colorado's got quite a few. Now, what does that guarantee you? Well, it guarantees you're probably going to get someone who gives you more time because it's a membership. So come in. I tell people come in once a year, twice a week. I don't care. It's whatever is appropriate for the person. So when someone says, "What can I do with the lower cost and all that sort of stuff?" Well, get friendly with a direct primary care. Most of us are buddies with a good health broker, an insurance broker, and go on a smart plan that covers the nasty stuff, but maybe not the regular stuff, because that's what my direct primary care does.
Okay.
Can people save money by not covering the regular stuff and just covering more catastrophic stuff?
On the insurance side.
On the insurance side.
Definitely.
Okay.
Definitely. And it's insane. Well, I don't know if I should get into all this, but there's insurance, and then there's another thing called health shares. So, and that's where it's a kind of a cost sharing. It's not insurance because that's a legal term. It's not
Okay.
deductibles. That's a legal term.
Okay.
But there are health shares that cover the bigger things if they come, but they don't cover the other things.
Right.
So yes, you can pair them up and try to get a smart plan where I actually get care versus am I covered? So
Okay.
I'll tell you a quick story about that. And you guys don't know this about me, but I mean, I could be kind of quiet or I could talk for years. So if you open the box, it's like the Jack in the Box springing out. So, well, anyway, ask a question or whatever.
No,
I'll just-
it's great.
No,
I know very little about this world.
All right.
I know specifically about more the pediatric side, just because we got thrown into it.
Yep.
But it's good to know when to have insurance, when
Yep.
to use it, when do you actually go to urgent care, when is it going to benefit
Sure.
you, as what different causes makes you go there. What's going to help your pocketbook?
Yep.
And when is it? Because I'm going to throw myself under the bus here. I do not have
You'll
a
need insurance if you do that. Don't throw it under the bus.
I love your sense of humor. I won't do it intentionally. I do not have a primary care doctor. I haven't had one for several years because when I get a little bit of a cough or whatever, I know where to go because it's going to cost me $30 to walk in. They'll do the strep and bronchitis and
Yep.
all that stuff, and I'll know what to do. And when I need someone like a cardiologist, like a pulmonologist, I am going straight to them, like through a children's hospital or Rocky Mountain Children's Health. So it's interesting and hard and challenging to navigate, especially for me. I had no clue what I was doing. And I find most people honestly don't.
Yes.
I agree with that. Most people definitely don't. And especially in a day today where people get their information from places where they should not get their information. Like social media, just random people just like, oh, you should eat meat. You shouldn't eat meat. You should do this. You shouldn't do that. And actually talking about that, another question just came in. And if anybody does have any questions, you can just type it into the comments on the Facebook feed and we can answer them. But we have a question. What is one underrated, since you're a professional, what is one underrated habit that can significantly improve overall health in your mind?
I like that. Good question.
That is quite
It's a
broad.
very, very...
So I'll answer it.
question.
There's billions, but I'll just say
Right.
walking.
Walking.
Yep.
Movement. It's what we heard about yesterday.
Yep. So walking specifically, because if we think about your ancestors through evolution, not 100 years ago, not 1,000, let's go like 50,000. Did they join CrossFit? Probably not. Did they go run a marathon? Like, no, not unless something chased them that long. But probably they walked everywhere. You
Right.
want lunch? Let's get moving. So I don't want to say that's the minimum, but it's underrated. As a younger guy, I'd be like, psh, walking's a waste of time. Let me go run or nothing. It was all or none. It's kind of silly. Knees aren't quite what they used to be. I can still do it. I could pass my fitness tests and all that stuff, but walking, it's way less impact. So is that enough? For some people, it has to be. But my ancestors, I think, what if they like hunted something and killed it? Did they like order an Uber? You probably
Yes. Of course they did.
You probably have to carry the thing back. It's like, oh crud, how are we going to get it back there?
Right.
You're going to drag it.
Yeah,
Exactly.
drag
And
it
you're
or
going to throw it over or something like that. So strength training is really important. But I'll leave it at that. But actually, I'll look at Dave right now and I'll say water. Drink water and
Right.
then
And walk.
walking.
Well, especially today when a lot of jobs are just sitting at a desk, looking at computers all day. And yeah, we were at a conference meeting yesterday, and there was a presenter that said, just walk a half hour a day. Just walk, and even
think it
said
was
she
even
hates
less than
running
that.
because I don't like running either. But walking is just very significant when it comes to overall.
It's and I can have fun going down any of these avenues, but a couple of years ago I had a surgery on a tendon in my elbow, and I was all sad for myself because I couldn't do any strength training stuff, and I was like, fine, let's go walk the dogs. And one day I was like, how do you walk harder? I was like, oh, what if you throw a pack on with weight?
Yep. Yeah.
Like, you call it rucking, but if that might sound intense, but you can literally throw a backpack on with a couple cans of soup or something like that, and it's just walking harder. So easy little things. It's not expensive to go walking.
Right.
So that and
sure.
drinking some water.
I love that you absolutely. Yeah, she talked about nutrition, which is really interesting to me because when we hear nutrition, it's like, okay, now I have to go on my diet, which is not true. I don't know anyone who can stay on a diet ever. It's always trying different diets, and I wish people would stop. But I am also not the expert. You are. And every single human being on planet Earth needs something else inside of their body. Like someone could eat bread all day and feel great. I would eat a piece of pizza and I'm ready to go sleep. So it's nutrition, but it's probably speaking to your body. And am I way off base? Am I in the ballpark?
No, I could have fun with all these things. So I use, in medicine, in the kind where we're dealing with real health, a lot of times we talk about pillars. So, I always hold up my hand and I tell people like this, there's 5 basic pillars. There's nutrition. Because remember, we're an animal. Animals need nutrition. Movement, physical activity, sleep,
Yep.
stress relief. And then for us particularly, sense of purpose. Why are you in this tribe? Are you even part of the tribe anymore? That's a huge one.
A lot of that is mental health, I would say. Yeah.
Well, and yeah, I'll go sideways a little bit. So we say mental health, like, oh my God, are you depressed or are you not depressed? Like we all have depression and anxiety.
It's part of life.
It's a continuum.
Right.
And if it's too extreme, we just call it bipolar, but it's the same thing. So who doesn't have something? And I'll tell you, I see people in the exam room. So, you have someone who's on social media. Oh my God, they look amazing. They're so smiley and happy. If you find out behind the doors,
Exactly.
it's terrifying. And you say, why is it almost all of us? Is that normal for this animal? Like, no, we're awesome. We're survivors. Like, what's wrong? It's because we're not living like we're supposed to.
Right.
And that's not a judgment. That's a reality. Like you said, with food. So nutrition. What's your ancestral best nutrition plan? Who the heck knows? I don't know. I'm a mutt at this point. Like I'm not, I don't know what they did 50,000 years ago,
Right.
Or let's say 10,000, so I joke and I tell people, if your ancestors were Amazon tree living people, they ate 100% fruit maybe. And you're like, but I heard fruit was bad for diabetes. They're like, well, no, this is what we eat. You say, I'm going to be a carnivore. I'm like, the hell you are. You're a plant eater. We eat fruit. And Sarah, on the other hand, she was Plains people, and they're like, we eat bison. One day she says, I'm going to be a vegan. They're like, well, good job. Good luck starving because we eat beef.
I hope
Right.
you didn't just say that about me to be vegan. I'm quite the opposite.
Well, but it's really challenging. And talking about what should I not eat? Oh, I'll give you a list. That's easy. But what should I eat? That's really hard. And I've spent years and I'm still figuring this out. We just did a food allergy panel and high on my list was beef. I was like, you got to be kidding me.
Oh, I'm sorry.
And then Dave made me go to a steakhouse and I was like, oh, what do I get?
Oh, that's
Yeah.
cruel. You
Yeah,
know,
pretty
if I think I know the Dave you're talking about, and we
Yep.
can smack him around a little bit.
We will. We will. Mean. But seriously, like that to me is perplexing, is to say, how is it we're so disconnected with what we are meant to be doing?
Right.
You know, and I joke, and some people say, oh, I had a stressful week. I'm going to go on a bender tonight and eat garbage. Like,
Then
what
you're
other
gonna
animal-
feel worse.
Well, what other animal does that? Like, and sometimes I tell teenagers this, like, imagine a zebra's like, man, I almost died this week. Sunday's a rest day. I'm laying down all day. Maybe I'll have salmon. Like, it's a zebra. It's going to have grass and it's going to continue to walk and run around.
Right.
So, but for us, and it's funny you said we're going to feel worse. Like, how do we reward ourselves? I'm going to have a cake and I'll have this thing.
Everyone says I'm going to cheat day, or
And how do I cheat?
Exactly.
And how do I, when I'm mad or angry, how do our treatment, our reward and our punishment is the same. It's really weird. It tends to be with food that's not good for us.
Right.
So bizarre, but why? And it's because we're disconnected from who we can be and all that stuff.
Right. Well, I wanted to mention, I know those people are listening. So we were talking to Adam, and the company is Ascent Concierge Health, and it's ascentmedicine.com.
Yes.
So what kind of you were hitting on, you have a spot on your website, which I really love, called Lifestyle Corner.
Yep.
And it has all these different articles and to speak, because I read this last night, because I find this stuff fascinating. I'm always trying to learn about how our body is, what we need to put in it, how to make ourselves live a little bit longer. We literally talked about movement yesterday, that 10 minutes a day can make you live 10 years longer. I don't know if that's really statistically correct, but it's movement, right? And it's feeding your soul. So you have this article, Can We Eat Our Way to Longevity? And what's the short answer? What's the long answer?
I think I would first say another couple of key phrases are, we want to live longer. Suffering?
Oh,
Oh,
true.
no, then I don't.
Yeah.
exactly.
And I used to work, in my little experience, I used to work in nursing homes. You know, I'm not going to diss any of them, but like not really where I'm going for vacation.
Right.
Yep.
And it wasn't the people living there. Sometimes it was the families. Like it sucked a little bit out of my soul. So the idea of living longer, a lot of people, especially the young guys, like, I don't want to live forever. And I jokingly say, oh, we'll keep you alive. Don't worry. So that's lifespan. How many days will I have on earth? Health span is how many days are going to be healthy.
Right.
And on average, there's a difference of about 10 years. So 10 years are going to kind of stink. You know, and you'll have your chronic things. You'll be, you know, unable to go visit the grandkids or whatever you want to do. So that delta, 10 years is a big, long time. So the goal, yeah, living longer, cool. That sounds good. But living longer, better.
Right.
That's what I want.
For
and
sure.
And I joke with people. I say, if I go for a hike one day and drop dead the next day, boom, thumbs up. That's what I want.
I'm with you. I love hanging out with great whites. I try and do it as frequently as I can. We love skydiving. I'm like, it's been real. I've loved my time here. And when my time's up, my time's up.
Yep.
But I agree. I know, you know, of course, we all know people who either have chronic illness or who are suffering. And that that sounds miserable.
Well,
You know,
and
it's-
I'll say this, most of those things, and I hope I never sound judgy, but most of those things didn't happen in a day
For
or
sure.
a week
They
or
build
a
up.
year. They build up. So, and this might segue because you just, could you eat your way to longevity? But those things start decades ahead. But what do we focus on? What brought you in today? What's your problem? And here's what we do about it. Like, imagine if we said, rewind 30 years and
Exactly.
say, here's the trajectory. I hate that word. I can never say it. Trajectory. But
have it.
here's the plan, and here's how you can change that little bit of a bit in an array. It doesn't have to be a big angle change, but, you know, fast forward 20, 30 years, and it's a difference.
Absolutely.
And earlier you just said, this is not making fun of you, we all say, why go see a primary? Because it's a waste of time. I just sat there for 2 hours. I paid $50. It was 10 minutes. Average, I think, is 9 minutes. And they spent most of the time staring at the computer. Why bother? If I need to go see a cardiologist, I'll just go. Or if I need to go whatever. But one or both of you said something, but basically, you're not trained in this stuff.
Right. Exactly. And you
So-
don't have anyone with a baseline as
Right.
well that you don't see on a regular basis.
So the mindset of I go in when I'm sick, like, do you ever bring your car in for a tune-up? Is it sick? No, I don't want it to get sick.
Right.
Exactly.
Or do you ever like clean out the vents in your house or do whatever else? We do proactive.
Right.
Everyone calls it preventative, but really it's proactive approaches. So what about your body? So like simple things like don't answer rhetorical questions, but when was the last time you checked your vitamin D? Or, blood vessel inflammation marker of homocysteine. Like nobody does that stuff. And I was chatting with a friend of mine who runs a cardiology clinic, and she was like, you check homocysteine? It assesses, it's a blood vessel inflammation marker. I said, yeah, don't you? And she said, yeah, my heart failure patients. And I was like, shouldn't we check for heart failure? Like, it'd be nice to know.
Right.
In that particular value, if it's elevated, there's studies that show small vessel dementia is associated with high homocysteine. So for my age range, which is 103, but the range goes up to 14.5. I want it less than 10. Less than 8 is better. So 14.5. Mine is about 15 or 16. I checked it 7 years ago. I was like, oh, the treatment's methylated B vitamins. I take a B vitamin in the morning, and my level, I've gotten it down to about 9.5.
Wow.
So easy.
Yeah, yeah.
And now I'm not saying I prevented my own dementia, but maybe I altered the course a little bit.
Like, could have.
That's what we should be doing. That's
Absolutely.
way too easy.
Yeah.
As much as we can do to be feeling better and be healthier.
Exactly.
Yep.
I am so guilty of it. I wait until it's do or die.
But you're frustrated with the darn system because try being proactive. How does that work? They're like, what are you here for? A wellness check. Really? You look good. Actually, I did that once with dermatology. I was in Massachusetts. I think I was still in school. So my wife was there. We had a baby. I'm there in my little underwear. And the guy walks in. Sounds like a joke. The guy walks into the room and, what are you here for? And I think I was probably about 30 at the time. And I said, skin check. Mm-hmm. And he literally, like I'm looking at you, he said, it looks fine. Like, if you have any issues, give us a call. And walked out. And I literally almost say, like, I joke, but I almost felt like I was violated. I was like, what the heck?
Yeah.
Since then, knowing what I know, dermatologist is like, I'm going to check between your toes, your butt crack, and everything. And that's what they should be doing.
Right.
So, anyway.
Okay.
We did get another question, actually, and I definitely want to throw these out there if people are watching and listening in. This is from a listener. What are your top 5 supplements for longevity and health?
Okay.
Top 5.
Yep. I'm going to remember to answer, but then I will say there's a caution because a lot of people want to supplement their way to good health.
Okay.
But if you don't have nutrition, physical activity, sleep, stress relief, sense of purpose.
Oh, you mean a pill can't fix everything?
Well, a pill
Adam,
for the ill.
Sure.
And I have a friend of mine who says a lot of people are stepping over dollars to pick up the pennies. So supplements, I just caution with. Having said that, a lot of people, fish oil as an anti-inflammatory, magnesium, they say upwards of 70% of adults are deficient because we grow our food in dirt instead of soil. So magnesium for a lot of people, but I like to do individual. So this isn't like, not everybody should do this. Vitamin D is almost assured. And that one, for instance, the recommendation for an adult is 400 units a day and 15 minutes of sunshine. But nobody checks the levels. So if you check someone's level and it's dirt, you need to take more. You might have to take 5,000 units instead of 400. So I said fish oil,
Magnesium,
vitamin D.
vitamin D. Some people B. And then, I actually do take a number of supplements, but depending on the person, sometimes probiotics, certain ones.
Okay.
I'll stick with that for now.
Okay. I have a silly question.
They go in your mouth. Oh, what? Is it a different question? Sorry.
Not all of them.
Oh, that's awesome.
about
Thank
that.
you. I don't even need to ask now. You were talking about the butt just a couple moments ago. So, that was a fair question. Can you test, do you recommend doing a blood panel or blood workup once a year or more often?
Yeah, I was going to ask, how often would you recommend people do test for all this?
So there are the regular tests, which are good for the vital stuff, like getting your complete blood count, CBC, check your blood cells. They'll do a basic thyroid usually, metabolic panel. They might just do kidneys, but I like liver on there. And then a cholesterol panel. Those are very basic. So for me, and like with insurance medicine, they say, don't answer. How old are you? Okay, we'll do this test. For me, I say, well, what's good for the human? So we'll check hormones, we'll check extended thyroid, we'll check insulin, like I said, some of the inflammatory markers. So I think it's great as a baseline to understand, because some people look really good doing it, but underneath, it's a disaster. I've had patients that are competitive athletes and they're pre-diabetic. Like, what?
Yeah.
So anyway, getting a pretty extended panel is good as a baseline. And then how often?
How often?
So I tell people, it's like when you go to school. So if you guys said, hey, we're going to go back and get a master's in, making plastic bottles, it's going to be a 3-year program. And at the end of the program, I'll let you know if you passed. You'd say, well, oh, I kind of want some feedback.
Right.
Like maybe I say, okay, fine. I'll give you a daily report card. You say, oh God,
That's
too
a
much.
little much. Yeah.
Too much. Maybe every month or every quarter, you would want feedback.
Yep.
Well, same thing with the body. So it's a report card. That blood panel is the report card to say, are you getting an A plus, or are you kind of getting an average, a C? You're like everyone else, or is it an F? So if you change nothing, we don't really need to check anything anytime soon. So 6, 12 months, whatever. But if you're like, I want to crush this, I'm going to try to go cut out not carbs, that'd be foolish. Gluten, I meant to say gluten. So I'm going to cut out gluten for a month or two.
Very hard.
And see if that affects my thyroid antibodies. Cool. We don't need to check everything, but maybe get a report card on that subject that you're studying. Or I'm completely inactive. I'm pointing at him. No, I'm completely inactive, and I'm going to go for that 20 to 30 minute walk, and then maybe I'll see if my inflammatory markers go down. Like, yes, that. So, I mean, I check 3 to 6 months probably in myself.
Okay.
So it depends on what we're looking at, too.
True, exactly. I remember when I went in and my triglycerides were high, and they wanted me to come back, I believe, in 6 months as I worked on it. So, kind of all depends on what it is.
So
Or
just
what
curious,
your-
and I don't mean to put you in the
Sure,
spot.
yeah.
But like when I do these things, did they explain what does that mean if the triglycerides are high?
I know. I had to do a lot of my own research, and my stepfather's very big into health too, so he kind of talked to me about it. They just said what I have to do.
So what do you have to do? And again,
No.
You could
it's
say
fine.
buzz off.
No, that's fine. Actually, one big thing was alcohol, which really skyrockets it.
can, yep.
Or it can. So, yeah, that was the main thing. I wanted to get to another question here, and I really like how people are using our platform to ask questions. What are some of the most exciting advancements? Because a lot of what you do is education and technology. Technology is definitely advancements. What are some of the most exciting advancements in medicine right now that you would say?
Wow, that's a pretty broad question. Advancements. So, I guess to make individualized care, it's good to understand the question. Not that question, a different question. Meaning, I'll use an example. So statistically, what's probably going to kill us? Cardiovascular disease, maybe cancer.
Asteroid.
Boeing.
Could be that, neurodegenerative stuff, maybe diabetes.
Great white shark.
Yep, that one, yes.
Pavement.
So for the medical thing, sometimes people have a fear. They have their confirmation bias. I'm going to die of heart stuff. We can look at that and answer that. And actually, I did that myself a couple of years ago. So that, meaning, well, I'll give you the story. So I was a couple of years ago, 50. I'm almost 52 now. So I was 50, and as I'm doing all this stuff, and I'm thinking, and I'm studying these advanced things, I'm thinking, my mom was dead at 63 of heart stuff. And I was like, do I have a baker's dozen left? Like, what are we doing here? So it's probably heart stuff. And I was like, well, I could look into it. So you do advanced cholesterol markers. And why do we check cholesterol? In the regular lipid panel, I don't want to say it's useless, but very limited. But there are other things you could check. Why? Well, we presume that means plaque buildup. All right, that's a little bit more interesting, but who cares? Well, we presume that might affect heart attack, stroke. There's the money. That's what we're talking about. So cholesterol markers, and even the advanced ones, can give us a hint. But what's closer? Why don't we look at the plaque? So a couple of years ago, I had a CT scan of the heart to look at my plaque buildup. And I'll answer this because I have nothing to hide. So I tell people, I'm laying there, I'm thinking medicine stink. I don't want to take medicine. I'm not going to take a horrible statin. They have side effects. And then I had the voice in the epiphany that was like, you know what else has a side effect, moron? Heart attack. And a stroke has side effects too. And I was like, fine, I'll probably take one. And thankfully, the study was perfect. I have no plaque buildup. I was like, woohoo. But as advancements, I could do that. And not to say, oh, great, I'm going to start eating like a slob and, start smoking and all this stuff. Like, no, I still want to do my best.
Right.
But maybe I should start thinking about the other things on my list. So, brain health, no, my ancestors were all pretty good there. Cancer, not a lot. We have a lot of obesity and diabetes. That's what I got to watch out for. So that should be my laser focus on that one. And that's what we should be doing.
Right.
So we have these fears of things, but why? Are they founded or not? So that's pretty cool. And then also being able to do like labs that don't have to be stupid expensive, and we can do these things.
Right.
So what was it? Two advancements was the thing. So,
Yeah.
So labs and certain imaging. It's pretty wild.
And talking about labs too, this actually brings into another question here, because we've been kind of talking about labs, talking about things that you should be testing. What labs should somebody take to figure out? This is a question online. Hormones balance. What lab should be taken to figure out hormones balance?
So it's a good question. Would I ever check hormones in a young adult? Yeah. Just because they should be perfect. And if they're not, there's something
You
out
would
of
hope
balance.
so, exactly. Yeah.
Right. And a lot are not. Why?
Yeah.
It's the same pillars. But anyway, so I think the question is asking which ones. So thyroid's a hormone. So you can check the TSH, free T4, free T3, thyroid antibodies, which is autoimmune, but the sex hormones. So in that system, it actually starts with cholesterol. That's why people think cholesterol is bad. Like, no, bad cholesterol is bad, but cholesterol is necessary. Pregnenolone, so DHEA-S, the sulfate one. DHEA, testosterone free in total. Women, we check progesterone. Estradiol, which is E2. Sex hormone binding globulin is the taxi that carries them around. Those are the ones off the top of my head
and
for hormones.
to test.
But also insulin's a hormone. So when I want to know your sugar status, we do a glucose, which is a spot check. That's don't eat, what's your sugar? And then there's an average, the A1C. And then there's insulin, which is what helps get the sugar out of the highway bloodstream and into the cells, and that's insulin.
I actually find, and this is very general speaking, I talk to women a lot about this. In your 30s, especially in your 40s, when you go into premenopause, you're in menopause, it is very rare when your hormones are tested. And I find that very shocking. Women, if you are out there, go get this tested, because it affects every part of your life. It's affecting how much weight you gain, how much weight you're losing, how much rest are you getting. And a lot of times we blame it. I don't want to say that word, but we're using other things saying this is why I'm not getting rest. And there's so many other factors that hormones are entered into it. If you have had a baby, if you are struggling having a baby, if you are anything is going on in your midsection, like we discount that a lot. So it's the truth that I went to so many doctors. I was struggling getting pregnant, and none of them tested my hormones over and over and over. And then boom, it's like, oh my gosh, this is actually a thing where we have estrogen and progesterone. And if you're out of whack for whatever reason, it's real. So,
And the nice thing is you could say, what's not for you, but just generally, what's the problem? You say, well, this is off. We can change that, but then we ask the question, why is it off?
What's
right.
causing
exactly.
it to be off?
It's the root
Right.
concern. It's
Yep.
not to put a Band-Aid on it, because I think in a lot of situations we can, just as humans, and I'm guilty of it. I will wait until the knee absolutely busts open until I'm having surgery. So it is really important to get to the root cause of why aren't you getting restful sleep?
Yep.
Or why are you gaining weight all of a sudden and nothing else has really changed? So it's really important. Go ahead.
Oh, no, I just wanted to put this in there just because we do have listeners asking questions. Just two real quick, because everybody talks about fasting.
Yep.
One question is, what are the health benefits of intermittent fasting? And then two, which that we definitely need to get into the end of this, is the programs that you offer for new patients.
Sure. So fasting. How long is too long?
A day.
Too long. No,
25 minutes.
well, and for me, again, I always go back to ancestral living, and like maybe your people were more foragers, and you could pick up a little bit more often. So you snack, you do little things, but I mean, they weren't going through the grocery aisle. So I mean, there were periods of no food.
Right.
Of a fast, which was very often overnight. So you break the fast, you have your breakfast. But when? And for some people, if you guys are hunters, you wake up in the morning, you're like, God, not much left over in the fridge because we ate it all last night, and we don't have a fridge. So, maybe a tiny little snack, but then it's time to move. So maybe they were moving all day long and were unsuccessful. Maybe you don't eat, or maybe they do whatever. So I think a period of rest for your gut is a good thing. Remember, we evolved with challenges, with some starvation. I'm not saying we should starve now, but the whole thing is most of us don't even remember what hunger feels like. And I've done that before, been like, God, I don't remember the last time I was actually hungry because, oh, what time is it? Eating time. We don't listen to our bodies. So for some people, they can go longer and some people not. And I'll give you a quick story. I had a man who's very small. He's very slight, very, very thin. And he's diabetic. I was like, how are you diabetic? He's like, I don't even eat much. And I'm like, huh. So we're going through his food log, looking at some stuff. And I said, you're not eating enough. He goes, I don't need more. And I was like, so what do we do? I had him wear a continuous glucose monitor, CGM on his shoulder. And then a couple of days later, he's like, holy crap. The longer I don't eat, the higher my sugars go. Because when you're too long, it's a stress. So stress releases cortisol, releases insulin, all this other stuff. So too long's too long. So how do you know?
Yeah, how do you know?
Well, if we're really in tune with our bodies, and I have a hard time listening to my body because I'm like, ooh, food. But for me, I tend not to eat breakfast, but I take some amino acids. And it's tough because for some of us, I just talked to a few patients yesterday, some of us, it's yeah, I own it. It's control. That's why we all have eating disorders, and there's big eating disorders and little. So I'm not trying to lighten that, but we don't know how to eat food. Like again, zebras aren't like, I'm not eating that delicious looking grass. I am on a fast. No, they're like, it's time to eat.
Right.
And crunch, crunch, crunch. So it really depends on the person. That's why I'm struggling to answer the question. Some people 8 hours, which is really pretty short, but at least 12, or is it 16? How do we know for sure? Well, we can check blood sugar and see what that's doing. But some people try to do a longer fast and I feel horrible. That's probably too long. Now, sometimes if it's when you first start doing something, it's because I'm trained mentally. It's time to eat and my sugars might drop. So do it carefully, work with someone. But yeah, that was kind of long-winded. So
No, it's not. We know.
It's
Yeah.
very complex. And there are some people that do days. And my brother is like, oh, he did 72 hours water. I think that's amazing for a mental accomplishment, right? And what does it do to the body? And in a way, the hormesis, the stress, the body's like, what the heck is going on? Let's get to work. So you start breaking down some of the old nasty cells, maybe turn on that bone marrow to make the better cells. So the little stressors are good. So I'm not saying people should go hungry, but sometimes if you're like, oh, all there is garbage, I guess I'll eat it. Like you can skip a meal, especially if you guys travel and all that stuff. You can skip the airport food. You will live, guaranteed.
It's too expensive anyway.
Yeah, I know.
See, well, and I've heard, honestly, the opposite as well is true. If you go multiple days, your body thinks that you are starving, which essentially you are. So it actually starts building up more fat cells. Is there truth to that?
And that's talking about fat versus other things. So,
Okay.
Yes. So think about that. The animal evolution, like we starved a lot. So we developed an amazing ability to store fat. It doesn't really require much of any blood flow. It doesn't really require calories. So it's perfect. Like what a genius evolutionary tact that we got. Muscle, on the other hand, is very expensive. A lot of blood flow, a lot of calories. So if your brain's like you're starving, which one's going to drop? Your muscle, definitely.
That always goes first.
Yep. Yeah. So, and that's why, we like to check body composition with, you can do scans and stuff like that. But, and that's why we're talking about a lot of different things. So is it good? And that's the other thing, like you said this earlier, diet. What's the best diet? It's like, well, that implies there's one type of human.
Exactly.
But we had like 8 billion. So there is no one diet. It's trying to figure out what works best for your body.
Right.
And I always joke, like in a family, husband, wife, or whatever, I say, unless you guys are related by blood, you don't necessarily, you're not necessarily supposed to eat the same food. Maybe we should change it up a little bit, like little bits and stuff like that. So
Right.
Individualized. The other thing was programs, right?
What
Yeah.
makes you, a little bit different.
And actually, you just said, so what I'm gathering here is, we all are different, have different bodies. You need to
Yep.
know what is going on in your body.
Yes.
And you need to get tested, kind of see where different levels are. So might kind of go into the different programs that you offer. And I
Sure.
really want to get into what you do.
Yep. So in 2018, back to that little story, that's when I started NuMed, NUMED. So, but if you put it a lowercase m, it looks like Noomed. So big N, big M, but NuMed Direct Primary Care. And that's where we decided to do primary care better. And it is. I can tell you any DPC in the country is probably going to be better than the regular because they have more time. It's going to make financially more sense. So it's better care. But it took me a couple of years because I was so passionate about learning this stuff. And I was like, let me get certified in hormone therapies. Let me go do this. Let me study longevity. Let me go look into psychedelic medicine, all these cool things to help humans. And then I realized it took me years. I was actually working with a coach just a couple years ago. And she's like, you do more than a lot of the other practices. You just spend more time. Like, we should change your programs up a little bit. So NewMed's the one that's 5 minutes from here, and we do better primary care. It's awesome. We do the hormones, we do all that stuff. And then about a year and a half ago, it was in the work for years, but about a year and a half ago, we created Ascent to try. We said the training wheels earlier is how do we do the best assessment, the best care? And the answer was, how do we do some of these labs? How do we do some of these images, these imaging studies and all that stuff? So that's what we do there.
Okay.
So that's Ascent.
Awesome. Okay. I love that you talk about images. To me, that is huge advancement in a very short period of time. I mean, I'll use my kiddo as the example. He had an ASD, and what they can see, they can actually see it. They did not do this with me. We didn't know till after he was born.
Sure.
But to see it when a woman is pregnant, to be able to do a scan and even do surgery on the baby while the woman is pregnant. I mean, that is
fascinating.
I know. When my mom gave birth to us, it was like, hey, you're here. We don't know if you're a boy or a girl, and hope you're healthy. Like, that was, I mean, that wasn't, too long ago, a couple decades ago.
Well, in that whole concept that you just mentioned is how do we take better care of things that could happen, the not good things. And that's exactly that. Like, that's what we should be using Western medicine for.
Right.
That is freaking amazing. And if you could do surgery on a unborn baby, like that's amazing. But we shouldn't be using that to just wait till the other kids get broken.
Right.
Like, we should be working. And you guys, I don't know if you heard this yesterday, you mentioned the conference, but, type 2 diabetes used to be like the 40-year-olds, 30-year-olds, 20-year-olds. And now they're down to, like, I don't know, the lowest I think might be 4.
Yeah.
Like, that's not normal for this animal.
Right.
It's very abnormal, but it's becoming average.
Right.
And that should be unacceptable. And that's that frustration. Like, I'm not going to see that primary anymore. They don't do anything.
I know.
Yep.
Welcome to my world. It's all good. Well, yeah. Was there another one that you had pop in?
Not actually on here, but really just for me. So
Just started off with, I have a friend.
I have a friend, exactly. No, I'm very interested in this. So you mentioned a while ago memberships.
Yep.
It's just like a medical membership. Instead of using your insurance for all the little things, you use it for the catastrophes, and you have a membership to do the little things. So the DPCs, they are membership based.
Yes.
Okay. And one, on average, what is the cost of a membership? And two, in this membership, how often do you go in, or is it depending on who you are and your health? So, which it is, yeah.
No, so Colorado is not the lowest cost of living state. So it can be a little bit more, but in the country, I'm just going to say roughly maybe 75 to probably 150 or so a month. Yep. And that's unlimited visits. So, like you said, how often do they come in? Like, some people, like, they're like, I just want to come in if I have to. Fine, this is freedom. Do whatever. As they get comfortable and they get to know me or whoever, is they say, well, I heard about this thing. Can I look at this thing? And now we're starting to get towards proactive. So should we check these things?
Now they start getting curious, and yeah, exactly.
Which is wonderful. Ask questions, because I'm still going to go Google my own personal things. You're going to do the same thing, but why don't we work together and try to come up with the benefits of a billion years of education and all that stuff. So there's that. So membership part. Another thing is, I think pretty universally with DPCs is we get wholesale labs, and this should blow your mind. So if you want to get, just as an example, a basic cholesterol panel, lipid panel, and you walk into LabCorp, sounds like another joke, but you walk into LabCorp, like, I want a lipid panel, and they're like, you're paying, I don't know, $75. And it's funny, I got a bill by accident that, whatever, but it went to the insurance or something. It was $113 for a basic cholesterol panel. Now, I called up and said, I'm a patient and I need to pay less, $75. Don't quote me on the exact number, but about that.
Yeah.
But if I said, no, bill TRICARE, well, then it might be about $20, $25. If they bill my practice, it costs me $2. And I mark it up 10% so I don't lose fees, lose on the cost of credit card fees. So I'm going to charge you $2.20. And you're like, oh, well, I can't check my cholesterol because it's been only been, you can check it whenever you want. If it's smart. So that's how like we can check hormones. Women's hormones might be about $40. It's not that much.
Right.
And that's why if you walk into an insurance-based practice, and this happened to a friend of ours, she's 52, and she went in and said, I think I just want to have them checked. And they said, oh, honey, don't worry about it. Yours are fine. Like, holy good God.
How do you know?
I want those eyeballs. How did they know that?
Exactly.
So it's, if you have a question, it can be answered.
Right.
And it doesn't have to be ridiculous. But I had another patient. So our full panel for the patient walking in is like $3,800. But if we get billed for it, it's about $140. It's not much. So I had one patient who was like, I want it to go to my insurance. I said, okay. So you have to put a justification, which I did for all the things. But they said under no circumstances were they going to pay for his vitamin D. So his bill for vitamin D was $248. And I was like, oh, he just paid an extra $100. It's just insane.
Right.
So it doesn't have to be. Same thing. If you need an x-ray, you don't have to use insurance. Now, there's a bunch of little weird things in the insurance world. I'm probably going to get killed tonight. But
No, it's good. We're going through some stuff.
Well, and I always wondered this, and I was listening to another podcast of someone talking about insurance things, and I was wondering, like, if I send you to go pick up your medicine, and I say, oh, use GoodRx, like, and some people come and they say, oh, they had to bill my insurance. Like, what do you mean? That's weird. Oh, sometimes if you want your pharmacy to get all of this insurance money from X insurance, then you have to. It's like a gag order. You can't be offering other things, or else you're going to miss out on those other $2 million. So therefore, you, the patient, and this is insane. There was someone the other week who, I think with the insurance, it was like $10, no big deal. The cash price was $2. Like, what the heck are we doing? And that's why, So that's why I took my toys out of the sandbox, and I said, I'm not playing this game.
I did want to get to, we did have one more question, and I kind of like this one because we at K4CO Radio really honor our military. We love our military right here. And just curious if you or other DPCs, if they offer things like PTSD treatment, stuff like that.
Okay, it's a good question. I can't speak to the other DPCs. So, one, on a basic level, if you're struggling with something, it's kind of nice when someone listens to you. That's the basic level. That's a start, as opposed to, oh, honey, don't worry about it. Just take this pill. So just having someone who listens, I think that's a good basic part. From there are a bunch of other things. And again, my job is instead of seeing 30 patients a day, we see 5, depends on the day. So I have time on purpose. I'm always busy because I'll go find the therapists. So there are some therapists that are really good with these things. So like ketamine is a treatment, to mention a word. If you put that on social media, it gets blocked. It's a bad word. It's a wonderful drug. We use it in the military for combat medicine. When someone has a horrible combat injury, if you use ketamine versus, say, morphine, they seem to have less PTSD. Like, amazing. So there's a lot of those sort of things. So like, yes, we do some... we work with the therapists in the community and all that stuff. So, yes, we do some ketamine treatments. I found that to be mind-blowing for anxiety, depression, PTSD. I haven't seen we don't have as many of these in our clinic, but some people chronic pain can be lessened. So again, if we take off the training wheels and say, but drugs are bad. Like, yeah, no, I'm not talking about illicit stuff that was baked in your friend's basement. We're talking about, FDA approved medications and all that stuff. So, yes, I don't know if that answers that.
Yeah.
No, it did. I know we have to wrap up here pretty quickly, but one thing we didn't.
Goodbye.
I
thought you meant really quickly.
No, not that quick. I love your sense of humor. It's nice. It's good to have no, you're not a child. A doctor who has a sense of humor. When a new patient comes to you, do they always have to come to you? Do you offer Zoom consultations? And can you go to them?
So, all the above. I don't do too many house things. We started with some, but a lot of people, there's travel time and all that stuff. So not a ton of that, but I have.
Okay.
I've gone to nursing homes as this practice. Let's not torture people. So, no, really. So, and I tell people, again, when we take out the other considerations, we say, how do I care for you better? And if you have questions about your cholesterol, do you really need to come in and drive 35 minutes? And some people want to. Great, come on in. So it's unlimited visits. But a lot of people are like, hey, can we review the labs? So we do Zoom, we do texting, we have a portal, telephone still works, and then in person. So, and it's funny, everyone's different. I have a 19-year-old. He's like, to review the labs, can I come in person? I kind of like it when you draw on the paper, like not draw butterflies, but I write lab. I put my ranges everywhere. And I put triglycerides, or the fatty part of the molecule driven by sugar. So it makes me think of sugar. Sometimes alcohol, but sugar also. Like all that sort of stuff. We talk about each value. So some people like it on the screen. Either way, so it's customized. It's whatever's appropriate. If you call me saying, hey, this is the worst belly pain I've ever had, can you just prescribe something? No.
Right.
You need to come in so I can touch that thing. Make sure it's nothing horrible, or is it what's going on?
Right. Okay. No, I love it. Well, that makes such a difference to actually have a concierge practice, to actually get to the root cause. Say you're an individual walking in, you're very different from everyone else that walked in today, which is nice. I've been in many situations where you check the boxes and yep, here's a pill, and sometimes they never even look up at you. So it's nice. I've been there. So thank you for, this is why you created Ascent. You're like, I'm going to do this better and a little bit differently.
100%.
So I love it. Well, for those of you tuning in, this will be up on our Facebook and Instagram. If you didn't catch all of it. So we've been talking with Adam and his company, Ascent Concierge Health, and also NewMed, with direct primary care. And we have your phone number, 719-735-8377. And you can find more information. I highly recommend. I mean, we didn't even have time to cover all of your website. You do so. I wanted to talk to you about your 9 summits in 9 months. You have all these different goals and different plans. If you go to ascentmedicine.com, you can read all really cool articles on the Lifestyle Corner and find out more about your practice too.
Well, thanks, guys.
So absolutely. Thank you for coming in. I hope you come in again, because there's so much to uncover about health.
We could have an entire show or even Sunday about this.
Exactly.
There's just a lot to talk about.
It is. We could talk about just movement and exercise and what your diet is, or your genealogy. Is that
Yes,
a real word?
That's
Awesome.
a
It's
word.
different than the genie in the bottle. That one's different.
Oh, okay.
The genealogy
It's kind of
is
the
your family
same.
tree.
You never know. Good for me.
Great song.
I'm on target on Friday.
Yeah.
Well, thank you again.
Thank you very much. Adam Courchaine, 719-735-8377, ascentmedicine.com. Thank you very much for coming in.
Thanks, guys.
We really appreciate it. And if you do have some questions or anything like that after the fact, I'm sure you can comment on them, and we'll see if we can answer those for you. So we're going to get you back to the regular scheduled programming, our afternoon mix of music here. And thank you very much for tuning in. Have a wonderful rest of the Friday, everybody.
See ya.